Good afternoon, ladies and gents. My name is Wayne Kirkham, and I'm a Senior Manager for Primary Care in Langston, South Cumbria, which is part of the Northwest setup. And myself and a very good friend and colleague of mine, Kate Burnett, are just going to talk to you for the next 5 or 10 minutes all about primary care and the opportunities for primary care as a career, hopefully, for a lot of you that have joined the conference today. So massive thanks for the opportunity to join in with the virtual conference. Both myself and Kate were lucky enough to be part of the live conference and had a really good day. And this year it's different, and we're doing it virtually just as good, and it's just as good a part of that. So thank everybody, Raj and the team, for the massive support that they've given us. So briefly then, primary care, the reason I'd like to talk to you about it today, as with all parts of the healthcare, primary care have got immense pressures with our workforce, and recruitment is top of the agenda for us. And there's lots of high-level targets out there that we've got to reach over the years. With GP target recruiting 6,000 additional GPs, but then we've got targets where we're looking to increase the practice nursing cohort by 50,000. We're looking at increasing additional clinical roles into primary care by another 26,000, and also we've got a target where we need to offer 50 million more appointments to our patient population. So the slide that you can see in front of you basically just gives you a bit of background about primary care, and we're working in new spheres, new times at the moment. As most of you, I'm sure, will be aware, we're changing over to what we call primary care networks, and these are basically practices coming together to work in conjunction with each other to offer health services across a patient population averaging anywhere between 30 and 50,000, and we do have some super networks with a patient cohort of anywhere up to 1,000. So for Langston South Cumbria, we've got 42 primary care networks, which covers and within that there's varying all different sorts of practices, the sizes of and roles that they employ. And the slide that gives you a bit of background to the makeup of general practice on the whole. So as we all know, we all class general practice as being the front door to the health service, and we're normally the first point of call for a lot of the patient population. So therefore we need a workforce to meet that demand. And as I've already said, the work is definitely top of my portfolio that takes up the majority of my working day. And it's not just about recruiting new clinical staff into primary care, it's about how we retain our current workforce. And to do that, I'm a big believer, and I'm really passionate about ensuring that we look after our workforce, first and foremost their health and well-being, that we develop the workforce and allow them to develop themselves as individuals, to allow them to learn new skills and to put those skills to good use. So that is a really important part about development, because it's been one of our biggest areas of the workforce decreasing, is that we haven't developed our staff enough and given them enough opportunities and enough variety for them want to stay with primary care. So development is a really big thing for us, and to develop a lot of staff, it's looking at opportunities, not just opportunities within primary care, but opportunities to work at a system level and to work across the system. So to offer staff portfolio roles and to offer new staff, and especially new GPs, the younger cohort that's coming into general practice, the opportunity to have express an interest in certain portfolio areas that they'd like to work, and that doesn't necessarily mean sat in primary care. That can be working in an acute or secondary care sector as well. So we've got to look at how we build that model into primary care, how we look at the massive advantages and advances that we've made with the digital technology that we're now using in primary care. And when you look at pre-pandemic across England, we was on average we was offering digital services to approximately 23% of our population, whereas now during the pandemic and coming out the other side of the pandemic, we're now reaching in excess of 85 of our patient population by using digital technology. So that is definitely going to play a part in primary care going forward, and so it should, because it offers flexibility to the patient. It also offers flexibility to the workforce, and one of the biggest areas that we have to focus on for our workforce is allowing them to have a better work-life balance than what they've had previously, and using digital technology allows them to do that. So that is definitely here to stay. So it's looking at the advances that we've made and how we can implement that into our services and implement it into the workforce going forward to take full advantage of it. So I would say now is a really good time. If you're thinking of primary care as a career, now is a really good time, because you've got the opportunity to build what primary care needs to look like going forward. It's changing dramatically to what it ever has been since we were first born way back in 1948, and we are seeing more and more advances made in not just the way that we offer our services, but within the clinical roles that are now coming into general practice. And again, if we look back only a matter of 18 months, 2 years ago, when we first started looking at primary care networks and additional clinical roles that could work within a network, we had on offer in the region of about 4 or 5 different clinical roles. We now have in excess of 10, 12 new clinical roles, and that includes our colleagues in physician associates, our pharmacists, clinical pharmacy technicians. It's also including the dietitians and our social prescribing link workers, which are really strong and will be an evolving strong arm of our workforce to deliver services to the patient population, because within the social prescribing, we have to think about the health inequalities and also the population health management that has to be taken into consideration when we deliver any of our services. And then also we've got ever advancing nursing roles within primary care, and then also we've got paramedics coming into primary care. So there's lots of opportunities for different AHP, AMP roles, and we are working closely with our in HEE to develop these roles. But as I previously said, a really big and important part of this is the health and well-being. And if I can just briefly bring Kate in to talk briefly about that.
Yeah, I think it's such a privilege to be, thank you for that, Wayne. It's such a privilege to be part of this healthcare career conference. You're looking for a career in healthcare. What a brilliant time to join healthcare, both for yourself, for the care and compassion that healthcare can deliver for you, and also the care and compassion that you can deliver for other people. So thank you, and thank you very much for inviting us on today.